In part 2 of this video series, I'm going to talk about screening for neck pain according to the KNGF Guideline 2016. Hi and welcome back to Physiotutors. If you haven't watched part 1 of this video, click in the top right corner to get more information about the prognosis, course and categorization for neck pain. For the rest of the people, we will talk about screening for red flags if a patient comes without a referral from the GP or a specialist. Red flags are patterns of signs and symptoms that may indicate a possible serious, specific cause of neck pain. Let's look at a list of possible serious diseases in the cervical spine. Number 1. Fractures. So signs and symptoms that could indicate a fracture are older age, trauma in patient history, longer use of corticosteroids because they weaken connective tissue, and osteoporosis because obviously the weaker your bone structure, the more likely you are to fall victim to a fracture. Number 2. Cervical artery dysfunction. Typical symptoms are dizziness, diplopia, which is when you see everything double, malaise, vomiting, weakness in the extremities, and papillary changes. Number 3. Damage to the spinal cord or cervical myelopathy. In this case, your patient would present with neurological symptoms like, for example, widespread weakness or changes in sensibility in both arms or legs, or bowel and bladder dysfunction. Number 4. Infection, including infections of the urinary passage or skin infections. Those symptoms include fever, nocturnal sweating, and other risk factors for infections, such as an underlying cause of a disease, the use of immunosuppressives, an open wound, intravenous drug use, or the exposure to contagious diseases. Number 5. Malignity. Typical signs and symptoms here are a history of cancer, no improvement of the complaints within 4 weeks, unexplained weight loss, an age above 50, and problems with swallowing, headache, and vomiting. And the last category of red flags are systemic diseases like herpes zoster, ankylosing spondylitis, inflammatory arthritis, and rheumatoid arthritis. In this case, our patients will present with headaches, fever, a one-sided skin rash, and itching, which are indicative of herpes zoster in this case, and burning pain. If you can recognize a pattern, or if you have a feeling of uncertainty, you should always refer the patient back to his GP. In this case, we are talking about a neck pain patient who is categorized in grade 4. Alright, this was part 2 of our KNGF Neck Pain Guideline Series. Make sure to click on the video right next to me to continue with the diagnosing part. As always, I hope you like this video and you give it a thumbs up. Hit the subscribe button and follow us on Facebook, Instagram or physiotutors.com, and I'll see you in the next video. Bye.